started. Welcome, everyone. Looks like we've got a few people on already. Hopefully, more will be joining. This is our last class of the year in this Preventing Diabetes series. We've been through 11 other classes, one a month, and hopefully you've been implementing the things along the way, the things you've been learning, and hopefully you're in a better place at the end of this year. And if not, you have all these resources and this information to go back to. We'll talk about that towards the end of class today. We're going to do a little recap, a little new information, some of those problem solving ideas from the book. And then if there's anything that we haven't touched on over the year, please do go ahead and put that in the chat or the Q&A. And, I'd love to add that to future series, so future classes, or possibly we might be able to address it tonight as well if we have time. So let's go ahead and get started. And just as a reminder, the reason that this really matters is that most people are either dealing with prediabetes themselves or know someone or living with someone or have a spouse or a child or a parent who has prediabetes. It's basically 1 in 3 adults in America. And those of you who are here and listening to the recording later, you actually know about it, which is not common. 8 out of 10 people don't even know that they have prediabetes. So kudos to all of you for getting this checked, for getting your labs, seeing your providers, having awareness so that you can actually do something about this. And we know that you can do something about it and that it really does make an impact. The other, big picture reason why we're thinking about this is because we don't want this to go on to develop into uncontrolled diabetes, because we know that costs a lot of money, but also it costs your quality of life, right? And it costs potentially longevity or higher risk factors for other things like heart disease, especially. But of course, eyes and kidneys and fingers and toes and brain health and all of that is impacted as well. So we're trying to just be proactive, get on the front end of this, make changes now, and prevent these risk factors or prevent these negative outcomes from happening. And the good news is that you really can prevent those outcomes. In the diabetes prevention trial, we saw even small amounts of weight loss really had significant impacts on preventing that progression of pre-diabetes to type 2 diabetes, even small amounts like 5 to 7% of body weight, along with a dietary intake like we have talked about. We'll review that tonight a little bit, and increasing physical activity to 150 minutes a week. And the results were pretty significant, a reduction of 58%, lower incidence of diabetes in that group who did those things. And actually in the group where people were a little bit older in age, so above age 60, they had even stronger response to those interventions and had a 71% decrease in incidence or progression to developing type 2 diabetes. And even later at the 10-year mark, and they even followed this group longer, 15-year mark, that group that was making changes to their lifestyle, exercising, had a little bit of weight loss, they still saw significant reduction in incidence of diabetes. So what you're doing like right now truly is going to affect your future with this. Here are some of the winning strategies from that Hallmark trial. People were monitoring their weight, they were tracking physical activity, reducing calorie intake, eating a balanced diet. Some were recording food intake to stay on track, managing their stress, changing negative thoughts into positive ones, or problem solving through that. Problem solving skills, developing those related to healthful eating and being active, like overcoming barriers to those things. and then maintaining motivation long term. These are all things we've talked about. They're all doable, not that they're easy, but they are within the realm of possibility. So, hopefully you've already implemented some of these winning strategies for yourselves. Let's just touch on the big four. So weight management, diet, physical activity, and sleep, just as a reminder as we're wrapping up, because these are the things that are really changing the needle on your insulin sensitivity, or another way to say that is reducing your insulin resistance, which is what's going on in type 2 diabetes and in pre-diabetes. And this really helps you to preserve your insulin function in your pancreas for a longer period of time. So we'll just touch on the weight loss thing. So remember that even that little bit of weight loss does do a lot as far as boosting insulin sensitivity. And especially for people who are also dealing with like fatty liver, because a lot of us, a lot of Americans now, because we have so many people in the overweight and obese category, a lot of people have fatty liver, which makes the insulin resistance even worse. And when you're losing weight, a lot of times you're losing it first from the liver. Like that is a place where we see small amounts, even a couple pounds makes a big difference in your fatty liver, which then impacts your metabolism and your insulin resistance. So I know like a lot of times people have these big goals, big picture goals and outcome goals with their weight, but just remember even tiny changes, a couple pounds does make a difference from an insulin sensitivity perspective. And then that leads to success, right? More success leads to more success typically. So don't set yourself up to be disappointed or to throw in the towel too soon if weight loss is one of your goals. It should take time. It should be slow enough so you're not losing the muscle. And even small amounts make a big difference. And then let's talk about the diet side of things. So just as a recap, we want to focus on the positive, focus on what to add. Definitely protein, especially at those tricky times of the day, like breakfast and snacks, because oftentimes we're missing protein there. And I gave you this little schematic again as a reminder. Protein and fat take longer to digest and absorb. So when you put them with the carbs, they slow down digestion of the carbs as well. So you're getting this more steady release of glucose, not the quick spike, but also not the quick drop. So you have more stable energy over your day. And that up and down motion with your blood sugar when you're pairing well is about like 3 to 5 hours, depending on how big that meal or snack was. So that's where we get that timing over the day, or the spacing of your meals and snacks over the day, so that you're not going too long and then having a crash and then overeating later. But you're also not stacking, so you're not eating like all the time, right? More fiber, more color, which really means more plants. And ideally, we'd try to get the rainbow, all the different colors. There was new research out on gut microbiome diversity being best in people who have at least 30 different plants a week. So that's a really good goal, like a very tangible, hard thing you can measure. Add up your plants for a week. Are you getting 30 different kinds of plants? And that's something to aim for if you're not. Structure with your timing, with your macronutrient pairing. A lot of this does come down to planning ahead, right? It's like having the snack available for you, having the nuts to go with your banana or whatever. Having a breakfast, and we're going to brainstorm breakfast earlier or later tonight, because that is one of those problem areas. Having a plan for that where you can just implement the plan. Packing a lunch or having lunch options stashed at work. Thinking ahead for dinner so you're not standing at the fridge at 6 o'clock going, what's for dinner? I heard he texted my husband right before this class. I'm like, here's the plan. Can you get it started? I'm going to be home late. So he will implement the plan. Um, variety both from a nutrition quality sense, as far as like getting not just your macronutrients, carbs, protein, fats, but really that variety then translates into your micronutrients, your vitamins, your minerals, right? So you're getting a variety of those micronutrients. And we will talk a little bit later about some specific micronutrients to be on the lookout for. And then that benefit to your microbiome. And really that is coming from, again, the plants. So it's variety of plants specifically for the microbiome, which can include herbs and spices. So, you are getting not really calories, not macro, but you are getting some micronutrients from herbs and spices. And you're definitely getting some of those other phytonutrients. So, things, like some antioxidants, for example, like in your chili spice or in your turmeric or in your curcumin. Um, you're getting all of those other phytonutrients along with some fiber, but not really like calories. So it's a win-win-win scenario there. Um, add some inspiration to your recipes and to your seasonal eating. If you're feeling stuck in a rut, do try and branch out from that variety sense. And then definitely we want to be thinking about hydration and adding water for most of us. Now, I will say I've had a few patients who are overdoing it on the water, like over a gallon a day. We do not need that much unless you have something specific going on that makes you, lose a lot of hydration. But yeah, you don't want to just dilute too much because there is such a thing as too much of a good thing, including water. Okay. Um, here's something in the chat from Carol. What about the many online videos from famous people who say that type 2 is caused by a small live creature in the pancreas, and that there's a very simple from your fridge solution? Hmm. But it is not advertised because the many companies getting rich from selling metformin and insulin block it. And then the video says click below. Okay, this is like classic clickbait and fear mongering, right? So they have basically said, there's a conspiracy that people don't know about and aren't being told. And there's a simple solution, right? They want it to be easy and simple and almost free. Of course, when you click through the links, it's definitely not free, right? Because it leads to they're selling their supplement or they're, selling their program or whatever it is. When you follow those rabbit trails, it leads to money, right? So don't buy into that. If you want reputable information, talk to your provider, go to the, large organizations that are having the scientists who are doing the work are putting their information in to these regulations and guidelines and handouts, like with the American Diabetes Association, or get a referral to your registered dietitian. We can talk through some of these myths, especially with things like supplements, which we're going to talk about a little bit later. But yeah, this is like, the classic formula, right? Fear, conspiracy, a simple solution. And then when you follow the rabbit trail, it leads to they're trying to make money off of you. And unfortunately, there's so much of that out there. But no, there's not a little critter living in your pancreas destroying your islet cells. Now, I will say that some types of diabetes, like for example, type 1, an autoimmune condition, the start of it can be triggered by a virus. And actually, people with type 1 diabetes are also at increased risk of other autoimmune conditions like celiac disease. And that has to do with their genetic predisposition to those. And we know what those genes are. So it's not that like we're not interacting with like viruses or bacteria. We certainly are. But of course, in this scenario, they're not naming what that thing is. They're saying it's like, some unknown creature. Like, okay. All right, let's move on. So movement and muscle. I know I've been talking about muscle and harping on muscle for the whole year. But it is really one of those things where we do see tremendous benefit from small inputs. We've had the research that has been done on the exercise snacks. In fact, there was a new one that just came out I read about this morning. Previously, it was 2 minutes, right? The research was done showing, okay, 2 minutes of moving your muscles post meal helps lower your blood sugar from that meal. Now we even have research down to 1 minute of something that is concerted exercise. Like it's really using your muscles, like push-ups, stairs, squats, things that are getting your muscles going and taking up the sugar. So even small amounts really can help when you're using your muscle or just sitting here, watching this video. If you have more muscle to begin with, or you're maintaining your muscle into the next decade of your life, even just sitting here, you will be utilizing glucose better because you have more muscle to burn it. And it is the preferred fuel for our muscle cells. So anytime you're using your muscle, or if you just have more muscle, that really helps with glucose management. And that muscle is over the long term, right? Because it takes a while for us to lose it. We are naturally losing it as we age, of course. Somewhere around 1 to 2% on average per year over age 30. But we know that for women, for example, after menopause, that average is not just 1 to 2% anymore. It could be 5% in a year. That, kind of increases because of the resistance to building muscle, partly from the hormonal changes, and also from changes in how we are gaining fat and not breaking down fat as much post menopause. That's a whole other topic. But just know, like, if we don't use it, we are naturally going to lose it. So it's a use it or lose it scenario. And the recommendation is at least 2 times resistance or strength exercises per week. A third time, you get extra benefit from that, right? And then, of course, we're aiming for the minimum cardio of 150 minutes per week, according to the physical activity guidelines. That's really where we see, like, that morbidity and mortality drop off is after 150 minutes per week. That's a moderate cardio, which if you forget what that is, go back to previous months and you can look at those videos. And then stretching as well to maintain flexibility, mobility, but also now we know that stretching actually does put resistance on muscles and ligaments and bones and then helps build those up as well. Do what you love so that you will stick with it. Have some accountability either to yourself or to a partner or to a dog, someone, be aware. Okay, and then sleep and stress. So quality and quantity do matter with both sleep and stress. How long are you sleeping? What is the quality of sleep? How much stress do you have? Are you de-stressing on a regular basis? And, with the stress management side of things, a lot of times that is a vicious cycle for people where they are feeling more stress and then they're using food as a coping mechanism because it does affect our neurotransmitters. It affects how we feel. It is calming to us. But ideally, we would find some non-food ways to de-stress. And if you are having specifically like binging or, you feel like you're eating large quantities out of emotional reasons, that definitely should be addressed with a therapist and a dietitian. If you've got other mental health things going on, depression, depression or anxiety are getting in the way of making healthful changes, we definitely want to address those things. And the same thing with sleep. A lot of times people don't even know that they have sleep disturbances happening, and then that's impacting their stress and their glucose and their cholesterol and their blood pressure, all kinds of things, and their weight management. And once we get the sleep apnea addressed or the sleeping quality addressed, a lot of times it makes all of those other things easier to manage because the sleep is so foundational. So yeah, don't skip over that piece. And then get outdoors, get some sunshine. Vitamin D is associated with poorer, like low vitamin D with poorer blood sugar control. And that's one of those things in the Northwest. We do have a hard time with vitamin D. So that is a specific nutrient. If you haven't had it checked, I highly recommend you getting it checked. Excuse me. You can add it to your next labs. Sometimes the providers are not doing it. Well, most of the time, unless you ask for it, they're not automatically doing it because there is a charge often associated with it, depending on your insurance. And so they don't like to just add a bunch of labs on top of the regular panel unless there's a specific reason. If you're tired or if you suspect you have low vitamin D, or you're older, if you're over age 60, you probably have low vitamin D. Or if you are someone who doesn't go outside a lot, and even in the summer, you're staying out of the sun, or if you've been in the, Pacific Northwest for a very long time, it's a good idea to get it checked because it does affect other things, not just blood sugar control, but long-term bone health and short-term immunity, for example. So, it's a hormone, so it has lots of different hormonal impacts throughout the body. So it's not just about blood sugar. Okay. And then we're trying to maintain, that positive mindset, get to your why. Why are you making changes? Really understand what you're working towards. Have a, big picture perspective on where you're headed from this, and then break it into chunks so that you can actually like set up your action plan of, what needs to be in place to do the thing, not just focusing on an outcome goal, because so many of us have those. Remember, to the very first class, we have those outcome goals of, oh, I want to lose weight, or I want my A1C to be a certain number. But that's not really a behavioral thing. That's an outcome. So you got to figure out, okay, what are the behavioral things that I can do or not do that is going to impact the long-term outcome goal, so that you're really working smarter rather than harder. Setting yourself up with people who are your supporters, people that you admire, people you can look up to, learn from, walk with, go out to eat with, and have a positive experience. All of this matters, right? Like it's this web of things that once you put it all together, it's going to be your long-term, like a blueprint for your long-term success. Okay. So that's a little recap of the big four: weight, diet, activity, and then sleep and stress. You have the previous classes to refer back to, so you can deep dive into those as needed. Let's get to the very back of the book where Jill talks about some of the common problems that come up, and one of them is breakfast. So I would love for you to put in the chat your own solutions to this problem, and then I'll share a few of my favorites with you as well. But you want to have a plan, or you want to have like a few options that are so fast and like they're your go-to things where you really don't have to think about it. When you're waking up in the morning, you don't have a lot of time, you're groggy, you're trying to get out the door. You kind of want it to just be plug and play, like, easy. She gives you a few grab and go options, and then I've added a few as well. So like a parfait, Greek style yogurt, or a strained yogurt where you've got higher protein there. You add some fruit, you add some granola. You can even take it to go, right? Put it in a mason jar and get out the door. Overnight oats is basically the same thing, but you've made it ahead of time. And instead of the, crunchy granola, it's just rolled oats, or even could be steel cut, although steel cut takes a little longer to soak. But usually it's rolled oats. Your protein could be the Greek yogurt, it could be protein powder, it could be a nut butter. You add whatever fruit you want, the apples, peaches, banana, berries, pick your fruit. It's really nice to add a little extra fiber for both blood sugar, but for satiety, for fullness. So a little sprinkle of chia or a sprinkle of flax in there. You could even add your Metamucil. You can add some psyllium in there or some hemp hearts. And then I like a little crunchy topping as well, like, slivers of almonds or pepitas or sunflower seeds on there. I will send you some recipes for breakfast. So I'll send you an overnight oats, or I'll have Christina through Stilly Valley Health do it. Overnight oats, I'll send you this egg muffin recipe where basically you use muffin tins. This is like when you go to Starbucks and you get the little egg bites, or at Costco now they have the little egg bites. The veggies are already in there. So you got veggies, maybe some cheese, or maybe some meat in there. But you batch cook it. So you cook one time and you've got 12 muffins to work from for your week. 2 for most people is a serving. And then it's grab and go. You can eat it cold. You can pop it in the microwave for 30 to 45 seconds. You can pair it with a carb if you want, like put it in a pita, put it in a tortilla, have it with an English muffin, have it with a piece of fruit. But it's a good protein source and you've got your color in there, right? Egg in a mug is brilliant for those who just like really want the most simple thing. You can do this if you're like working from home, for example, and you're trying to get on your computer, but you have a minute. You literally can crack an egg in a microwavable mug. I like to spray it with like a little oil first, just so it doesn't stick to the side so much. Whisk it up with an egg. If you want to put a little cheese or whatever leftover chopped up veggies you have ready to go, olives, peppers, green onions, leftover roasted broccoli, like whatever sounds good to you. Throw it in the mug. You just stir the whole thing, pop it in the microwave for 40 seconds. Cover it because they do kind of tend to explode sometimes. Don't overcook it. You might want to stop it at 20 seconds, see how it looks, do another 10, do another 10. But it's literally under a minute to make this. And then you just take your mug with you to the computer and you've got, a protein and some color there to start your day. Even if you just do something like grab a granola bar, but it's one that you can see the items, right? Like it is whole oats, whole nuts, whole seeds in there. And then you dip that in a little yogurt cup. That's very portable. You could take that to the office or eat it on the train. Leftover to breakfast is one of my favorites. Like literally a piece of leftover pizza. It has everything. It has your carbs, has your protein, has your color. There you could add a little extra greens, a little arugula or something if you wanted. But that's super fast out the door. I will send you a little handout on wraps because wraps are really versatile and you could go savory or you could go sweet with them. Or of course you can make, like a breakfast burrito. Some of my patients will actually batch cook this on weekends and then freeze them in little foil wrappers. And then they just take those with them to work, pop them in the microwave after you take the foil off for like a minute and they're, good to go. Or sometimes they'll do that even with like make your own breakfast sandwiches. Those are macronutrient paired. You probably want to add a little color to those sandwiches. So after you've thawed them or pop them in the microwave, a little bit of like arugula, for example, or a slice of tomato would be lovely. Or maybe you have a little bit of room for some fruit on the side, some berries or something. But with the wraps, basically you have a tortilla and you add your protein. That could be cream cheese, hummus, um, nut butters or seed butters like almond butter or sunflower butter. And then for the savory, you're going to go more like, veggie as your color. For the sweet, you'll go more fruit as your color. You could add some spice to that, like cinnamon, for example, on an almond banana wrap would be delicious. But it's so versatile that you can go lots of different ways with that. All right, let me just share what Lyle has said. He says, I try to have cold salmon or poultry in the fridge for quick protein in the morning. Yeah, absolutely. I love the salmon idea, like salmon on a whole wheat English muffin with a little cream cheese. Oh my gosh, that's so good. Okay, and then he goes on to say non-fat Greek or non-fat organic plain Greek yogurt with berries, no sugar added fruit spread. Yeah, brilliant. I love it. That's a great one. Yeah, even just leftover chicken. It's an easy protein, right? Oh, I just hit the stop share button. Let me get back to the slides. Okay, so breakfast. Smoothies. I'll send you some smoothie recipes as well in our smoothie handout. Um, the deal with smoothies is just a lot of times, like if you go eat them out somewhere or you buy like, the juices, it's just carbs. It's just a bunch of fruit blended together, maybe a little bit of vegetables, but not very much protein a lot of times. So when you're building your smoothie, you want to think about it just like you would think about it as a meal, especially if you are doing it as a meal replacement, right? So you want the yogurt or the nut butter or the protein powder in there, or even like a slice of tofu blends really well in a smoothie. It's bland. It basically just takes on the flavor of whatever fruit you use. And then ideally you would add a little bit of extra fiber and fat. So like some of the chia or ground flax or avocado. Nowadays you can buy avocado in the frozen section. It's in a bag, already diced up into cubes, perfectly ripe, ready to go, frozen. So you're not wondering, when is the avocado going to be ripe? And then you miss it, and then it's past ripe. Then you're throwing the avocado away. Just get it frozen. If you're using it for smoothies, just buy it frozen. Then you can just grab a little handful. Same thing with like, your berries that tend to be a little finicky. Just buy the purple berry organic, ready to go in the freezer section at Costco. It's very economical and you can just get like a little scoop of it for your smoothie. And then you're not spending a ton on berries and having them go bad. Or if you do buy fresh berries or you pick berries in the summer, get them in the freezer so that they will last you. So I'll send you a few recipes. Anybody else have other breakfast ideas you want to share? Go ahead and put them in the chat. Okay. We have we're at half an hour. We better keep going. Okay. Another very common problem, lack of support or like actual not just lack of support, but like sabotage by a partner or a parent or a child or, whoever you're living with, maybe a roommate. Sometimes people have a hard time when you're trying to make changes and make improvements. Sometimes that's hard for the people around you. And that's, they have their own stuff going on with that. But you need support. And so maybe that isn't going to come from your roommate, or maybe it's not going to come from your spouse or your partner. Um, but you do want to have an honest and open discussion about it. So you're not just, putting things under the rug and not asking. So do ask for support, have that conversation. They might not be open to it, but at least you have done your part. You have tried. And it's helpful to give very specific suggestions about, what do you actually need? Sometimes it's not clear to other people. And especially in, relationships where we are often attracted to people who are opposite of ourselves, you know, they may need something very different, or they may feel supported with something very different than how you want to be supported. So being very clear about what that is. For example, if it is like not having ice cream in the freezer or putting the ice cream in the deep freeze, like moving it out of sight, out of mind, that's a very specific, clear thing that seems pretty realistic and reasonable, right? And if you are feeling like there's actual sabotage, either from yourself, which sometimes we are self-sabotaging, or from someone else, that really does need to be addressed. Um, either in therapy or with a counselor, or just hashing it out with that person or with yourself. All right, let me check the chat really quick here. Lyle is asking about pea protein. Yeah, what do I think about pea protein? So yes, how they have formulated those, like for example, Orgain plant-based protein formulas, they are usually doing a mix. So it is a complete protein. It's all your essential amino acids. So it's not just pea, it's usually pea and rice in there. It's like a combo to make it complete. And those are fine. They will give you the same amount of protein. There is usually a little bit more fiber in there. So that's kind of a pro. There are also some other things like phytates and oxalates and stuff in the plants that make it a little harder to digest. But, the digestibility is, when we look at the scores compared to eggs, which is our standard, it is a little bit less digestible, but it's still pretty much all there. You're going to get the majority of that protein. So it's pretty negligible. Um, for vegetarians, what we typically recommend if you're going like completely vegetarian, we do calculations where we bump up the protein by like 10% to account for that digestibility issue. But otherwise, like, those powders, they have formulated them to be complete protein, so they're fine. But I will say that for my patients with GI issues, like if they, for example, don't tolerate FODMAPs, fermentable carbohydrates, or if they have small intestine bacterial overgrowth, they're going to have issues, a lot of bloating, gas with the pea protein. So just know that it's, if you're having issues, there may be something going on GI wise. Okay, yeah. And then Lorraine says, I love breakfast, so that's not a problem. Fantastic. I'm just trying so hard to cut carbs, but cannot afford to lose weight. How do I know how many carbs I can have? I really do plan my meal well. Yeah, to get that specific with it, Lorraine, that's where you would want to see a dietitian and actually like look at your whole day, look at your schedule, look at your activity level, run some numbers, look at, your weight, your trajectory of things. What are your goals with all of that? And then also, if you do have any data, like if you have an A1C or you have a glucometer where we can see what's going on blood sugar wise, that would give us even more information. But it sounds like you need to see a dietitian, especially because you really can't afford to lose more weight, so that you're not under consuming. Because it's not just about cutting carbs. Remember, with that pairing with the protein and the fat, that is one way to lower what we call the glycemic response from things, even things like white bread, for example, is totally different on your blood sugar when you put peanut butter on it. So it's not just about like cutting out carbs. And a lot of times that is unfortunately, that's the only thing that people really hear in the 9 minutes that you have with your primary care provider. And so, that message is not a complete message. So you really want to get with a dietitian to flesh that out for you and not over restrict. Because remember, carbohydrates are plants. And we are trying to have plenty of plants, and you're also trying to have plenty of energy as well. And you don't want to just like go too low, cut too many carbs, and then also have less fiber and nutrition. So yeah, it's definitely a balancing act. But it sounds like you need a little bit more one-on-one information there. And your provider should be referring you to a dietitian, so you can certainly ask for that referral. Okay. As far as like the support thing goes, you can seek support outside, like, for your friend group, for example. Um, of course, having the conversation, maybe setting some goals together with like a spouse or a partner, that could be helpful, where you do some compromising. Like maybe you want to go a little bit more plant-based and you can get together on an idea for meatless Mondays and ease the other person into that, and supporting you with that goal. And of course, counseling or therapy is always an option as well for yourself or for relationships. Okay, another common problem in the work environment, some of you are still working, and this can be really, really tricky, especially this time of year through the holidays, because a lot of times there's just treats and treats and treats. Um, so it is kind of nice if you want to set some rules for yourself. Jill calls them rules with exceptions. And her example was, only using the candy jar on Wednesday, for example, where you set some parameters so you don't have to think about it the rest of the week. Like Monday, Tuesday, you're not like wondering and, having the argument in your brain. Are you going to have it or you're not going to have it? No, the it's set up. The guideline is Wednesdays, right? So that's when you're going to enjoy it. You're going to be part of the social network there. You're going to enjoy the treats. So you're not over restricting on it either, but it's in a set, time frame. Or you could do the same thing with like a set amount. For example, alcohol at parties, which we'll talk about next. Um, you can definitely ask for support at the workplace as well. Ask your office mates to consolidate treats to one area, or ask and encourage healthier options where, maybe you don't have the treats there at all. And instead there's like some trail mix in a jar, or like little packages of trail mix for snacks if, that's something that they want to be sharing. Um, Here's some examples. Like when it becomes a very regular thing, like weekly donuts, that starts adding up. If you're, at work for 50 weeks out of the year, that's a lot of decisions to, either have the donut or not have the donut or how much. So if you can just change that environment or change that tradition, then you're not having to struggle with that decision. And also probably you're supporting your colleagues as well. Taking walking meetings or walking on breaks, that can be a social thing as well. And, a culture of movement, supporting that versus a culture of sitting. Asking to have vending machines changed to provide healthier food options. There are actually vending machines out nowadays that just have like whole foods in them. Those are available. Or real put together foods, like real fresh sandwiches that are rotated on a regular basis, or like little hummus cups with carrot sticks. Those exist. So, advocate for yourself and for your colleagues. Other strategies like sit to stand desks, walking pads. I know I was just at an organization who bought a bunch of walking pads for their employees to use just throughout the week. And they also have access to a small room where they put some weights in there, yoga mats, some resistance bands for stretching, and just said use that room whenever you want a break. Some places also have access to gyms or gym membership. So, think about how you can support yourself in this, if you're working in this, place and space where you're spending a lot of your time. It's like, I don't know, 8 to 10 hours a day, maybe. where you're in this environment, that's a big chunk of your day, probably 5 days a week. So if you can set up that environment just like you would set up your environment at home for success, that's going to be so much easier on you and helpful for everybody else. Check the. All right, let's continue on. So it's holiday season. There's probably get-togethers and parties and things that you're doing more than usual this time of year. It's helpful to kind of plan ahead in your mind, think about the scenario, like if it's out to eat, maybe you're already thinking about, do I want the appetizer or do I want the dessert? Maybe it's not all of them, right? Or do I want the mashed potatoes with dinner, or do I want to save room for a dessert from a carbohydrate sense? Like if you know for yourself, like that's going to be too much to do both, maybe you get the extra vegetables with the dinner so that you can have the cheesecake or, whatever it is that you're really wanting and that really matters to you, right? So think about what really matters to you so you can make that decision ahead of time and adjust and make some other swaps so that you really can make it fit. Staying hydrated, starting with mocktails instead of cocktails, and setting limits on high calorie drinks, like alcohol, a pour of wine. Of course, the pours are really large these days. The glasses have gotten bigger. So it's not just usually a 5 ounce pour, it's like sometimes an 8 ounce pour. That starts adding up both from a calorie sense, but then also from an affecting your inhibition sense. Because usually when we start drinking alcohol, then we actually eat more, and especially in that environment where there's lots of options and goodies and treats, it's easy to overdo it. So just be careful with that. Don't go hungry or try and like save up. That almost always backfires. If you're trying to like skip meals or skip your snack, you're going to end up being hungry, showing up for the party, and then that is not a recipe for success. In fact, Jill in the book talks about like have a snack proactively before you go so you're not showing up hungry. And then you can make, more rational choices because you're not just bonking. Try and be active if you can at the parties, mingle, stand. If there's an option to play games, do that. Or like if there's an option to connect with a friend and do a little walk about the property or something, try and move a little bit because it is a lot of like hanging out in one spot often and a lot of extra calories, right? So it's nice to just be a little bit more active if you can. Bring a healthful dish or a dish that you know is going to support your goals. Bring that to share. We're very like visual and proximal with how we eat. So even just like moving yourself away from the buffet or the bar or the dessert station or whatever it is to a place where you're not just seeing that stuff all the time, that can just out of sight, out of mind, right? It can be easier on you. And then you're focusing on ideally the people and the interaction with the people over the food or over the drinks. And then I like to use the 3-bite strategy. So we have some research showing that after 3 bites, our enjoyment of that thing really tanks. So we get the most satisfaction or most enjoyment with those first 3 bites. So if I really want to have something that's like kind of decadent, I will think about those, what is a portion of 3 bites and get that little portion so I can enjoy it. And then, kind of get it out of my system, right? Like enjoy the thing and move on. And then you're not over restricting either. Okay. On vacation, so it depends on your vacation. If you're in a car and you can pack food for like a road trip, that is brilliant. You can have a cooler with, ice packs or a way to keep things cold, ice in a baggie, whatever works for you. And then you can have some fresh stuff. You can cut up veggies, cut up fruit, cheese sticks, hard-boiled eggs, a whole sandwich ready to go, yogurt. Yeah, whatever sounds good. I would want like a little mini bagel with cream cheese and lox as a breakfast to go. Put it in the cooler. Or if you're traveling by like plane, for example, where you want something more shelf stable, think about dried foods like nuts, seeds, the little peanut butter packets, or like the Justin's peanut butter tear open packs, whole grain bars, dried fruit, maybe fresh fruit if it's portable, like an apple or like little tangerines or something. The Laughing Cow cheese wedges, they come in the rounds. That is shelf stable cheese. So sometimes I'll pack those for an airplane trip with carrot sticks and some like flat pretzels. So you've got a carb, a protein, and a color with that. It's a little mini meal. Dry roasted edamame is delicious. And you've got both carbs and protein in it. And it is a plant. It has a color. So in and of itself, that dry roasted edamame is like a very well-rounded snack. And it's nice and crunchy and a little salty. And nowadays you can find it with wasabi or other flavors on there, which is lovely. And then if you are staying at a hotel or motel, if you can get one with a mini fridge, that's great because then you can stock that, go to the grocery store, get some fresh items, or even go to the deli and get like a sandwich or something. And then you're saving on eating out and really controlling, what your choices are. Or stocking up for some breakfast options, especially if they don't have breakfast at the hotel, or they're just, a lot of the continental breakfasts aren't true continental in the sense that they're missing the protein and it's mostly just cheap carbohydrates, right? So even if you're just kind of supplementing with some hard-boiled eggs or some cream cheese, that you can put together with the bagel or the half bagel that's there, or like peanut butter that you can add to the French toast or whatever. That can be helpful to just kind of round out the options. Mhm. Do you check online nowadays? Most of the restaurants have menus. Sometimes they have reviews by people that will tell you like it was too salty, right? Or it was smothered in, too much sauce or whatever. So you can kind of get a sense ahead of time and maybe even pick your option ahead of time when you're on the road and looking at different places to eat out. If you can walk to dinner and walk to your other destinations, like if you're actually on vacation and going to museums or whatever, the more you can move, the more wiggle room you're going to have with the eating out. And it really gets you out to see, the city that you're in, and it makes it a whole other level of experience with where you're traveling to. Bring your water bottle, try and stay hydrated. If you can find a place that has a gym, like if you're staying at a hotel, a lot of hotels have gyms. Kind of scope it out online ahead of time, and bring some simple equipment, just like shoes, shorts, a t-shirt. Or if you can find a local gym, like if you're really into a particular type of circuit training or CrossFit or whatever you're into, do a little research to find a local gym. That's kind of fun. Or pack your own stuff for just in the hotel, like, a couple resistance bands or even one resistance band that rolls up into a teeny tiny, packs very, very small, put in a corner of a suitcase. And then when you get there, a lot of places do have yoga mats available, either just for free or for rent, or you can, get an extra towel and put that down on the floor and do your stretches, do your floor exercises, use your little resistance band. You can do a lot in a hotel room, actually, movement wise. So there's really no excuse when we're on vacation for kind of changing up or stopping our exercise because, wherever we are, if we have space for our body, we should be able to do some things. All right. Set some guidelines for yourself for treats. It's again that rules with exceptions, especially with the vacationing, because oftentimes we get in that vacation mindset and then that trickles into everything, the drinks, the appetizers, the desserts. So it can get to be a little bit much. And then the biggest thing is getting back into your routines when you get home, because the vacation is like, a set chunk of time. But then oftentimes what I see with my patients is that they do that and they have an enjoyable time, which is lovely, and they really need that decompression. But then when they get back home, they're out of their routines and it can be really hard to get back into the routine. And that's actually the bigger, more important thing, right? Is your day to day. What does your day to day look like? So even if you like totally go bananas on your vacation, but you come home after that week, maybe 2 weeks, and you get back into your routines, that's the majority of your life, right? So that's what's going to matter more. Okay, if you have any other strategies or things you want to add or other common problems to address, let me know. Put it in the chat. Next level with things. We've got a few minutes left here. I just want to touch on a couple things to have conversations about with your provider or your dietitian. There are some medications, not really for pre-diabetes, but there are some specific medications like GLP-1s, for example, that have been around for 20 years. The first GLP-1 was FDA approved for diabetes back in 2005. But now there are some GLP-1s that are FDA approved for obesity. So if you're in that pre-diabetes range and also have a BMI of 30 or above, you would qualify for some of these medications that may also help your blood sugar, right? So it's worth it to have that conversation with your provider. Just, do the pros and cons thing, because some of them do affect not just blood sugar, but some of your other goals, potentially weight management, food cravings. And of course, we know now that they're helpful for heart and kidney benefits. But there's definite cons to those. And you want to have, eyes wide open going into, if you are starting a medication, what those cons are. And ideally, if you are starting one of those medications, you do want to meet with a dietitian, because there are so many GI changes, constipation, diarrhea, bloating, other like worse things that happen. So you want to meet with a dietitian for that, but also to address the potential muscle loss, which can be pretty significant. So we want to make sure that you are not losing weight too fast, you're getting enough protein, your meal spacing is good. And most people need a little bit of help with that, because the GLP-1s really do affect appetite pretty dramatically. So if you're, going into that scenario, I would ask for a referral to address those things. And then also supplements. So I don't think we've addressed this very directly, but there are some specific micronutrients that if you are deficient in them, they are shown to affect your blood sugar. So zinc, magnesium, chromium, and vitamin D are the big four. They're easily checked. You can ask for a panel of these things. A lot of us do not get enough magnesium in our diet. If you are going vegan, or if you have some sort of issue with digestion where you're like suppressing stomach acid, for example, you might have low zinc. Chromium is associated with poor blood sugar. So, it might be worth it to get these things checked with your next labs. And then potentially we would be either supplementing or addressing it food wise, right? To get those up. There are some additional herbs and spices that have been shown in, the research is pretty minimal and it's mixed as far as like the quality of the research. But there is a little bit of research out showing things like ginger and cinnamon and turmeric and fenugreek and berberine, of course, added soluble fiber. And then even some, vegetables like bitter melon, which is more popular in Asian cuisines, can have effect on blood sugar. to the point where, there is the caveat that if you're on blood sugar lowering medications, you want to be careful about adding bitter melon because you could have a low blood sugar. Or you want to be careful about adding berberine because you could have a low blood sugar. And of course, these things are not like the supplements and the herbs, unless you're buying them as a food in the food section. Feel free, like with your real spices, throw cinnamon wherever you want it or add ginger wherever you want it. But if it's in a supplement, like as a capsule or a tincture or a tablet, those are not regulated the same as food. So we do want to be looking for third-party testing on those supplements or getting it from a reputable source that has already vetted that brand. Like, for example, Full Script is an online dispensary that vets the brands, and they're like more professional grade brands. So they're not going to necessarily be third-party tested, but they have been looked at. So you just want to be careful with the supplement side of things because a lot of times it doesn't even have what it says it has in there, and then you're just wasting your money. Or potentially it could even have some things that you really don't want. It could have some contamination issues or dosing issues, and then it becomes a safety issue. Okay, so that's kind of next level with all of this. And again, you would meet with your dietitian to talk about your supplements. Okay, so next steps for you, follow through. Ask your primary care, you're going to get labs. If you're not getting an A1C, ask for the A1C with your labs. Get your vitamin D checked, discuss medication options if that's something you want to consider. Ask for a referral to a dietitian. If you've got sleep stuff going on, ask for that referral to the sleep specialist. Or if you've got physical barriers, ask for a referral to physical therapy, or maybe you're looking into some personal training. From a mental social perspective, seek counseling to address any mental health barriers you've got going on. Maybe you're joining an exercise program that is more social, so it addresses both exercise and social and support. You can certainly attend more online classes through Stilly Valley Health Connections, and we do have our in-person cooking demos as well monthly. So if you're in the area, check those out or join us virtually. And then you've got your wellness vision. If you started with us at the very beginning, you've got that wellness vision. So keep that updated. It should be updated every once in a while, right? And you're going to probably change your behavioral goals every once in a while and keep it accessible. So it's like in front of you and it's not just out of sight, out of mind. And then you can go back and review the previous classes and use the book as a refresher. And we have been through a lot of information this year. It's been a whole lot. So hopefully you're feeling a little bit more inspired, a little bit more empowered to do some things, and you're making some changes for your health. Do reach out if you have any questions. For example, if you have questions about seeing a dietitian, you can reach out to us at Sound Dietitians. You can also reach out to the Academy of Nutrition and Dietetics at eatright.org to find a dietitian near you if you're like not in this area. Reach out to Stilly Valley. If you have ideas for future classes, we would love to hear them. You'll get a survey after tonight that you can share your experience and share your ideas on that survey. So please do fill that out. We look at those and we do change our classes based on those survey responses. There is one more chat here. Linda says, even on a cruise ship, don't be afraid to ask for what you need. Yeah, exactly. Dietary, exercise-wise, they will often accommodate your needs. Yeah, so if you're going on a cruise, there's a lot of resources actually, but sometimes you do have to ask for them. So be your own advocate in those scenarios. Love that. All right, happy and healthy holidays to you. If you've been with us all year, kudos and thank you for showing up. And know that next year we're going to do this a little different. We're not going to have the monthly check-ins, but we are going to have an in-person kind of like an intensive 3 class in person. I think we will also make it virtual. So it'll be like a combo of in person and virtual. And I will be up at Stilly Valley um, in Smoky Point. So if you want a refresher on this information or want some in person time, we're going to do that 3 class series in the early part of next year. I believe it's the and start in February, end of February. So check that out and hopefully see some of you in person. All right, take care, everybody. Healthy wishes. Bye bye.